Welcome to today's Facebook session. I'm Kay Hayes, Executive Director of the Presidential Advisory Council on HIV/AIDS, also known as PACHA. And I'm here with my colleagues, Dr. Richard Walitsky, Director of the HHS Office of HIV/AIDS and Infectious Disease Policy, and Jesse Mylan, President and CEO of AIDS United. Thank you so much for being with us. We're here today to talk about the name change of AIDS.gov to HIV.gov. And I'd like to say we have viewers that are joining us, and if you would type in below the screen where you're viewing from, we'd really appreciate that. AIDS.gov launched in 2006 and has become the federal government's leading source of information on HIV. Rich, why are we changing the name from AIDS.gov to HIV.gov?
Oh gosh, Kay, I've been asked that question so many times this week. Because people say, well, AIDS.gov was so popular. It had 8 million users last year and 350,000 followers on Twitter. Why would you mess that up? Why do you want to change the name? But the fact is, the science has changed. And where we're putting our emphasis now is on the full spectrum of HIV disease from before people have AIDS, including AIDS. It's more important now that people start treatment early. And we know if they're tested, start treatment, stay on treatment, most people with HIV will never go on to develop AIDS. In addition to that, our users are searching for HIV more than AIDS, and so it really reflects where people are at as well as where the science is at. Now, Kay, I know you have worked on this issue a little bit as well, too, in your role on PACHA. And PACHA members had a little bit to say about this as well. What came up there?
Right, so PACHA, phenomenal members, and several years ago, really in one of our annual meetings, talked about this evolution of what's been happening in the epidemic and really seeing the shift in need to go from AIDS, if you will, to HIV, and more emphasis because people are living with HIV and sort of that whole evolution. So PACHA has been right there in the forefront of these discussions and conversations about the name change for a long time.
Yeah, and I will say that we've gotten so many people writing into us and calling, sending emails and stuff saying how happy they were that we made this change. So.
Great. When we talk about the name change, we also talk about the challenges. And I think that's so critical. Jesse, what's happening with the HIV epidemic now?
Well, the real deal is that we have 1.1 million people living with HIV in this country. But the sad news is that 1 out of 7 of that 1.1 million people still don't know that they have HIV. They haven't been tested. They don't know. And I think we know, Rich and I know, that the first step to getting into good health care is knowing your status so that you can move on to get into treatment and care and hopefully become virally suppressed. But we still have so many populations that are not accessing the care that they need. Of that 1.1 million people, we are still adding new infections, but the good news that the CDC just reported is that the number of new infections in this country has gone down by 18% over a 6-year period. That's tremendously good news, but we still have barely half the people living with HIV in this country accessing health care to become virally suppressed. And that really is the gold standard for living a long and healthy life.
Right. Now, you talked about this 18% decline in incidence. Right. So I think, what lessons have we learned from that and sort of moving forward in a sense?
Well, that we really can end the HIV epidemic by reducing new infections literally to zero. And I think there are 2 pathways for people who are living with HIV to get into treatment and care and obtain a suppressed viral load. That Rich has and that I have. We now know that if you have a suppressed viral load that's consistent, you literally pose no risk of infecting anyone else. So that's one pathway for people living with HIV. But for people who are negative, we now have a tool that we never had before, and that's pre-exposure prophylaxis, or PrEP. If you take PrEP consistently as prescribed, you reduce the chance of you becoming infected by over 96%. So those 2 pathways can help us end this entire epidemic.
Right, absolutely. Now, Rich, that sounds like great news, but what are the other challenges?
So I want to say, first of all, it is great news. I mean, we've seen this reduction in new HIV infections across pretty much all populations in the country. And as Jesse said, viral suppression and PrEP are two important strategies, but we have to remember they add to existing strategies as well. So for some people, using condoms works, and for them, that may be a good strategy as well. But challenges. The sad thing is that not all populations and not all people in all places are benefiting equally from this progress. In some populations, there's been some improvement, but it hasn't been as much as it is in other populations. Because of that, we're seeing the disparities getting wider for blacks, Latinos, people in the South, for gay men. And in fact, for Latino gay men, we've seen new HIV infections increase, which is counter to the trend we've seen for pretty much every other population. The other thing that is kind of odd to think about is that there's still people who don't know the basic facts about HIV. They're misinformed. Right. They have alt facts. And because of that, they're afraid. They're fearful of being close to people with HIV, sharing food with them, back to the old days. And that's why it's important that we have places like HIV.gov where people can get accurate information.
Right.
And having accurate information is critical for fighting stigma, because so much stigma that people experience is because of fear. And that fear is coming oftentimes from inaccurate perceptions or beliefs about HIV and how it's transmitted.
Right. Well, I thank you for tuning in and listening. And we have viewers here from DC, Boston, Atlanta, San Diego, Michigan, and Florida. And we thank you for joining us. This week marked the 36th anniversary of the first report of what we would later come to call AIDS. And you're both living openly with HIV and been working in the field a very long time and can talk about your experiences and shared experiences. So Jesse, what can you share with us about that?
Well, I remember quite well that first news report 36 years ago about what was going on in San Francisco with gay men getting sick and dying. And I remember it sort of struck terror in my heart. And over those next 5 to 10 years of the 1980s, I had many personal losses, including my own late partner. And so living through those losses, giving those eulogies, seeing the people sick or with Kaposi sarcoma out in, walking the streets was really a sad time. But I also saw the resilience of the community. We built up the HIV/AIDS infrastructure to provide services to people. And we also built up policies at the national level and at state and local levels as well. The Ryan White Care Act and all of the work that we're doing today, including at the CDC. So we have so much to be thankful for from those early days of resilience and acting. But I also saw that we had great progress that the people who died in the 1980s and the 1990s would never get to see. Viral suppression so that you can live a long and healthy life, to be 50. Soon half of the people living with HIV, if they're taking their medications, will live to at least be 50. 50, 60, 70, those were not even possible then.
Right.
And now this new pathway, we've gone from having a toolbox that literally was just with condoms to a biomedical intervention called PrEP that, my goodness, is literally a miracle.
Right, right. And Rich, share some of your personal stories with us.
Listening to Jesse, it's kind of hard thinking back on how different things were back then. And I think, like, for myself, and probably for other people too, that we carry a lot of baggage from those early days, back when there weren't effective treatments, back when you didn't know what was going to happen to you, to your friends, if your family would reject you. There was just a lot. It was just really different. And then it all kind of changed in late 1995 when the new medications became available. So for me, I was diagnosed at a time before that. I was 29. I thought I would probably live another 4 or 5 years. And here I am now, decades later, and I'm probably going to be around for quite a while longer. And it's just a whole new ballgame. And I think for me, it's letting go of kind of that fear from the past and that pain, that loss, the sadness from those years is really kind of one of the hard things. But it's a whole new reality now, and really we have the tools to end the HIV epidemic. For anybody who has HIV, there's no reason why they should progress to develop AIDS. And as Jesse's saying, you know, the data show that people who are diagnosed with HIV now can have a life that's almost exactly the same as a peer who's HIV negative. So
It's great news.
That's great
yeah.
news.
And so
That's
now
great
we've kind
news.
of focused on this from the perspective of two people living with HIV, but I think one of the things that's critically important is that we recognize how HIV has an impact on the lives of people who are HIV negative. And Kay, I mean, you've worked in this field for so long, and as someone who is not living with HIV, I know this disease has had an impact on your life too.
Absolutely. I mean, I've been working in HIV for about 28 years, and I remember in the early days of still working in the field, you know, it's like family and coworkers, and you go to a conference and you meet wonderful coworkers and colleagues, and you go the next year and they have passed. And that was a cycle of that for the first, you know, maybe 6 or 7 years of working, and I was like, this is just devastating because you build relationships and friendships, and then people are gone. And so what I've seen over the years is the people I see year after year or month after month, because they're living healthy lives, and it's such, you know, the orthodoxy in that has changed, and it makes such a tremendous impact. And then I look at Pacha, and we have phenomenal women on Pacha, phenomenal members on Pacha, but I think last year in April, it kind of hit hard. It was a reality check that we lost a Pacha member, Reverend Vanessa Sharp. And she had been a champion on Pacha, you know, always keeping us authentic about making sure we were talking to communities, talking to women, lessons learned from her work in Africa, and trying to translate that in what was happening domestically. And for her to pass just was really that reality check, like, okay, this is tough. This is tough. And, you know, I have to, you know, lean on some of the other, you know, I have Gina Brown and Grizel Granados on Pacha that are very open about their status. And as others, but really trying to focus and lean on them to make sure we get it right.
It's
And
still
make sure we
real.
continue to get it right.
No, completely.
Because there's so much work. We made all this progress we've talked about, but there's so much more we have to do.
And it's still hard for people, because actually just today, I have a friend of mine who was diagnosed 4 years ago. He's going into his first HIV medical care appointment. And it's like he'd been in denial, couldn't deal with it, and it took him that long to get to this point.
And a year ago, this month, I lost a member of my church who was not in regular treatment, and he passed. And so we do have so much work to do to get the message out about how important it is to know your status, to get into treatment, to stay in treatment, and to provide all the support that we can for the community so that people do stay in treatment, and also break down that stigma. You know, the more we talk about HIV, the more the rest of your community can support you as a person living with HIV.
And for me, with, you know, you two openly living with HIV, it's like, how dare I even think about getting tired? Because you guys are tired.
I'm tired. I don't know. I don't know about Jesse, but I'm tired. So.
Okay. But yeah, but it kind of keeps me, you know, being authentic, like, just keep it moving. We've got more work to do.
Well.
So, but when we talk about all the progress that we've made and looking forward, what do you want people to take away from our conversations here today? Like, what do you want that take-away, take-home message to be?
To not be tired, that we have so much work to do. You know, we have only accomplished about half of what really needs to be done. Only about half of the people living in this country with HIV are achieving viral suppression. So we still have so much work to do. And even with the decline, we still have new infections. We need to stop them, and we know we can stop them. So I think we have to make sure that every elected official and every government official, whether at the federal level, the state, or the local level, understands the impact of the HIV community on our economy and on their communities. I think we have to make sure that we talk about it to our own families, our friends. The more we have the support from your cousin, your aunt, your uncle, and they're not afraid because they love you, they can help support you. And I think we have to make sure that we continue to keep our voice open and active so that we let the world know that HIV is still here and it's not over until it's over.
Right. Absolutely. Absolutely. Rich, would you like to add to that?
Yeah, Jesse and I think a lot alike. It's the great minds, huh, Jesse? But I mean, just to kind of, you know, add to that, I think it's critically important. We talk about the progress, there's still so much work to be done, and the progress that we've achieved could disappear in an instant if fewer people were on HIV treatment, more people would bounce back, their virus would go up, they'd get sick, they'd be more likely to transmit HIV. It's not that we can just check this off and say finished. We've still got a lot of work to do.
It's not easy living with HIV, and we especially want young people, people under 25, people under 20, to understand how they don't want this disease. It's very hard, but for those people who do have it, there is hope.
And more than 36,000 people get HIV each year. We've got people who are dying every year, and we keep on, like, sometimes we forget about that because of the excitement about how much better things really are. But this is still a major public health problem, and people living with HIV need support and assistance in doing the things that they need to do to stay healthy.
And HIV.gov is a great resource.
Absolutely.
Okay, there's our plug. Okay.
I use it all the time.
Absolutely. And something you said, Jesse, made me think when you talked about younger people. I have a young Pacha member who's just dynamic, Gabriel Maldonado, and he is that young voice that is constantly sort of challenging and bringing to the table to making sure that we're talking about young people, because their reality is a lot different than someone that was infected a long time ago. And it's the world is just different now.
It's very hard. When I hear a young person who has told me, that, especially a person who's under 25, who has said they just were diagnosed, they almost have a sense of failure. That how is it that after all this happened to me? But you know, it happens partly because there wasn't the community support around prevention. That's why we still have yet farther to go in terms of new infections, and to educate people that it is possible to not be infected. But for that young man who's 20, who I just met a few weeks ago, to encourage him to get into care and to also be a voice, so that those coming behind him don't have what he has.
Right, right. Well, we're coming to the end of our conversations here, and I want to make sure that we haven't left anything out of this, or you want to share additional information, because I want to make sure we cover it all.
Okay. Me first?
Yeah, go for it.
Okay, all right,
Go
there we
for it.
go. I think, I mean, as I was thinking about this, you know, one of the things that going through this whole experience the last 30 years has taught me is that we all have more strength within us than we realize sometimes. And I guess what I'd say to everybody who's watching is just don't be afraid. Don't stigmatize yourself if you're living with HIV or you're at risk for HIV. Be proud of who you are. Speak your truth, and don't let other people put you down. And don't put yourself down either.
Right.
And I'd simply add that there is hope, but it starts with knowing your status and being brave to know your status and to support each other. We support each other.
Right.
You support
I
us.
support.
You have positive and negative people, black, white,
Yes.
straight, gay.
Right.
We're all here.
Right.
That's what we can do, and that's what happens when we work together. We can make a difference.
Using our collective voice.
Yep.
Using our collective voice. Well, thank you. And I want to again thank our viewers in DC, Boston, Atlanta, San Diego, Michigan, and Florida. I had to do a shout out, so thank you and appreciate you.
Thank you. Thank you, Kay.
Thanks, Kay. And I just want to thank everybody who's watching as well, Jesse and Kay, and also to remind folks to check out the new website at HIV.gov, and also look for us on social media as well. So we look forward to interacting with you and hearing any thoughts or feedback that you have about the new site as well. So I think that's it. I think we're out.